guys. So I just wanted to take this opportunity to talk a little bit about what the experience has been like to be a new nurse or just even just a nurse in general working during the COVID-19 sort of outbreak pandemic. And basically like what the experience is and what I'm going through sort of on a more personal level, I guess, and like what my hospital is doing and just like kind of what it's like. Right now, there are 253 confirmed cases in Canada. So I believe that of those cases, 11 cases are resolved. This morning, there was 176 cases. So there have been an increasing number of cases, which I think is what they projected and what they expected. At the moment in Quebec, where I live, there were 17 cases this morning and there's now 24. There are, I think, around 850 cases under investigation at the moment. And yeah, my hospital where I work is one of the designated hospital for cases because we have a lot of negative pressure rooms, and my floor that I work on has negative pressure rooms. At the moment, we're not taking any cases on my floor, or we haven't had any cases on my floor of COVID-19, but we very well could have cases on my floor. We just haven't had any yet arrive on my floor. In the ER, they're ruling out cases. They are still getting a lot of rule out cases. And people are coming in a lot with symptoms that could be those cases and then waiting to be tested and discharged. And that's kind of like much more common, where people come in with the symptoms, they get tested, it turns out to not be that, and then they're able to go home afterwards. But then we have had some confirmed cases as well. So I would say that the hospital is like taking some precautions, which in order to like reduce the traffic. And that was something that was, I think it's a hospital decision, but also the Premier of Quebec had like put out a statement asking hospitals to limit the number of visitors to like basically zero unless absolutely essential, and to limit the number of people coming into the hospital. So like cancel anything that's non-essential, cancel appointments that are non-essential, and basically just limit the number of folks coming in and out of the hospital as much as possible. So yesterday when I arrived to work, I was on night shift last night. There was like all the doors were closed. All the normal doors that I would normally pass through were closed, and they had only left the main entrance open, and they had posted security at the main entrance, and security was all wearing masks. And as I came in, I had to say like, yeah, like I work here, I'm a nurse on this floor, and they were like, okay, and they let me in. So they were talking to everybody who came in and making sure they had a reason to be coming into the hospital, and if they were symptomatic, I'm guessing that there's particular measures that they put in place to make sure that that person's not going to be walking around the hospital touching a bunch of stuff before they're actually put into quarantine. So I think that this is a really good measure that the hospital's putting into place to try to kind of circumvent further spread within the hospital itself, because that is a big problem. And it's a little bit eerie, honestly. Like, it's weird to be going to the hospital and there's so much less people. Like, normally it's busy. Even at nighttime, it can be busy. Or not busy, but there's still traffic usually at nighttime. You still see visitors, you still see people, but there was nobody. Like, I was just me, and I saw like one security guard when I was walking around on my break. So it was a bit eerie. And then on top of that, like on a more macro level, the government is like putting things in place so that people are not going out and like spreading the virus. So basically like they are suggesting that if you're over 70 years old, that you're not out and about so that you don't contract it. So they're telling people to stay home if they're over 70. They're banning events of over 250 people. They are they closed all of the schools, all the universities, all the daycares, all of the CEGEPs, which is basically like college. And I think that that was a great measure because obviously groups of large people, like this is where we're going to have transmission. And I think there could be further steps as well. They may close the border from Canada to the United States because the United States has a lot more cases than we do. They may also put a ban on international travel, although they have said that they strongly discourage international travel. So there's a lot of things being put in place, and I think it's slowing already the progression, and I hopefully it will help us to not have a situation like other countries have seen, because as a healthcare professional and as a person, it's just not something that I would want to go through. So I'll try to get some shots, I guess, of the hospital and of like what it's like, just kind of like to give you guys an idea. But I have to be careful because I can't have any like patients or anything in the camera because I'm not allowed to do that. So I will try to include those in coming up next. Okay, thank you for watching. Hey guys, it's 3 in the morning. I am just getting ready to take a break and go to sleep for a little bit. I tried to get some footage of like myself on the way into the hospital, but it was really sketchy because there was like all this security at the front door and they had like roped off the entrances, and so when I was coming in, like they wanted to see my ID and I had to like basically prove that I was an employee to be able to get in because they're limiting, like there's no visitors allowed at all in the hospital unless like your family member is actually dying, and they're really limiting like who's allowed in the hospital and the traffic. And so like they're like all like non-essential procedures are canceled, and so yeah, it's really like the traffic in the hospital is like really notably lower. There's like nobody here. It's really crazy, just for me, because when I'm walking around there's like it's really quiet. It's eerie. So now I'm just like, I've got my little setup and I'm gonna try to get a little bit of sleep before the end of my shift. But yeah, sorry, I was trying to show you guys like what it looks like when you're trying to get in. It's like all the doors are blocked, and on the way in there's like ropes, and they kind of like, you have to like go around the rope and then they stop you and you have to like show your ID and everything to get in. So I was trying to show you that, but then I was like too scared to film it because like the security was there and I didn't want them to stop me. So sorry. I'll try to see if I can get it on the way out.